The African region, the African continent, in fact, has a relatively high burden of NTDs. So about 40% of the disease burden is in Africa. And as you know, we have nowhere near 40% of the world's population. So we are disproportionately affected as a continent and as an African region by these diseases, which is the reason why we have to make a huge amount of effort still to bring these under control and to go for the elimination, eradication, and control targets that have been agreed at the global level. I think one of the most remarkable things about the work in NTDs is the partnership between the governments, the countries, especially as far as we are concerned in Africa, the endemic countries, the development partners who are interested in this area. A very important aspect of the support is also the donation of drugs by the pharmaceutical companies. This is a component of the mass drug administration work that is absolutely crucial. Then I think combining that with the national programs, the governments that are working, and the community-based work that is going on. I mean, WHO is very strongly promoting what we call universal health coverage in the context of the Sustainable Development Goals, and recognizing that if countries want to do better in health overall, part of what you have to do, you have to target specifically those people that are most disadvantaged, including those in faraway places. And we've seen countries develop strategies for, first of all, how to distribute more fairly the health workforce. So even if you don't have, certainly we don't have enough doctors or even nurses, but there are some paramedical cadres that can be developed and trained, and some countries have done this, who can be trained to do basic healthcare provision, including carrying out cesarean sections. In a country like Malawi, in which I worked as a representative, we had what were called clinical officers. So these are people who've had a couple of years of training, who are carrying out cesarean sections in rural areas and able to save people's lives. So adapting to your context, developing other cadres, of course regulating them so that, and supervising so that the quality of service is good, is a way that countries can go while they try to develop or train and recruit the numbers of nurses, midwives, and doctors that are needed.